week 22. So we had a lot of fun. We just got back from bowling. Everyone I knew told me that, oh yeah, you can bowl like pregnant, you can bowl. I don't think so. We just got back from bowling, and first of all, it was hard to find a ball that didn't weigh 15 pounds. Second of all, so I did find a ball that was like 10 pounds. So that was nice. But then, the finger holes get kind of small. So whatever. And I had big hands. But I was able to bowl with that. But not well because the ball is heavy and just constantly picking up this heavy ball and throwing it, and it was a little overwhelming. So I set out like most of the time. Something I didn't get to talk about last week was when we had our sonogram. Is it sonogram or stanogram? Sonogram. They let us know that basically I had been diagnosed with placenta previa, right? Okay, and hubby's gonna tell you a little bit about what placenta previa is.
Placenta previa is when the placenta is at the lowest part in the uterus. It can cause some uterine cramping, and yeah, it's known as a complication.
You can at least sit up and tell the people what placenta previa is.
The people know that it's time for bed, and we're shooting
This
video
is a serious
at bedtime.
matter. This is a serious matter. Come on, honey. Be
Hello.
Team player.
I'm playing.
Okay, so basically it's when the placenta covers the cervix. Which, as you know, when you're giving birth, nothing should be covering the cervix because the baby needs to come out, and the placenta should be at the top so that it comes out as the after. You can at least sit up so people can see your face.
They see me.
Okay, basically, symptoms.
All right, I'm up. Symptoms are a bleeding vagina. Labor starts within several days after the bleeding vagina.
Honey, you're just a mess. This is a serious matter. You should at least know everything about it in case something happens.
Yep.
Okay, basically the symptoms are you can have painless bleeding, which means you don't feel any cramping, all of a sudden you're just bleeding. It could be quite a serious hemorrhage. Okay, and treatment, basically the doctor told us that it would definitely be, if the placenta does not move, they're going to do another, sonogram, of course, to make sure anyway. If the placenta does not move, then you basically know that you will be scheduled for a cesarean. Other treatments would be, depending on how much bleeding you have and how far along the baby is. Because, like, if you do start bleeding and it's not at a time that your baby will, be strong enough to survive on its own, they'll do what they can to stop the bleeding and give you some medication to make sure that your pregnancy continues until your baby is strong enough to live outside of your womb on its own. So basically, if you lose a lot of blood, you could need a blood transfusion. If you get a cesarean with this condition, it will most likely prevent death of the mother or death of the fetus, because that can happen.
This is caused by the placenta moves as the uterus stretches, but as the pregnancy progresses, the uterus should pull the placenta toward the top of the womb. Sometimes the placenta remains in the lower portion of the uterus, partly or completely covering this opening. This is called a previa.
There's no way to prevent this from happening to you. I mean, it just happens to some, and some it won't happen to. But the complications could be death, major bleeding, which is hemorrhaging, or your body could go into shock. There's also like an increase of infections, the blood clogs.
Prematurity, which is the infant is less than 36 weeks gestation, causes most infant deaths in case of placenta previa. Baby may lose blood if the placenta separates from the wall of the uterus during labor. The baby also can lose blood when the uterus is opened during a C-section delivery.
So at any point that you have bleeding from your vagina, you will want to contact your doctor anyway. And
Call that doctor once every month.
if you're pregnant, honey.
I know. I'm sorry. That was sorry. All right.
Because if you ignore the bleeding,
you got me on video looking crazy.
If you ignore the bleeding, it could be dangerous for you and baby. So I don't know. My doctor said he's basically gonna keep an eye on it and try to see, because it's very possible that it could move and not be in the way, you know. But if it doesn't move, then you know that's a cesarean. And the cesarean is not the bad part about it. The bad part about it would be if the hemorrhaging did start happening, if the bleeding started happening, you know. That would be the bad part. This is definitely something you would find out that you had through a sonogram. There is no other way for the doctors to know that you have it. So definitely make sure you get your sonograms and stuff like that.
Alright, here's the belly shot.
Belly shot.
Belly shot.
I got on all these clothes because we went bowling, so I want to make sure none of me was like hanging out anywhere, because I did have on a dress because it's kind of hot outside. All right. Out.
Oh my gosh, it's kicking.
I shut up.
It's kicking.
Bill Cosby show, and those people are walking down these invisible steps, the clowns, and they go, and then they go, but I can't do that. Whew. Aren't you exhausted, honey?
Yes.
I'm exhausted. Come on the pillow so you can say bye. Oh goodness. All right.
Bye-bye.
Bye.
Thanks for watching.